Hello and welcome to Fuel Poverty Action series of monthly learning sessions, Fuel for Thought, from fuel poverty to climate justice. Fuel poverty is a group of ordinary people fed up with being robbed by greedy energy companies through spiraling bills and rip-off prepayment meters. We campaign to protect people from fuel poverty. We challenge rip-off energy companies and unfair policies that leave people to endure cold homes. And we take action for warm, well-insulated homes and clean and affordable energy under the control of people and communities, not private companies. Fuel for Thought is our space to share research and lived experience, tackle lies and clear up confusion on fuel poverty and climate change as we ask and answer questions with experts, activists, and campaigners. Our session today is intended to raise discussion on energy pricing in light of having a new Labour government in power now. And Fuel Poverty Action has been putting a lot of pressure on the government to take action to lower people's bills, which since September has included engaging ministers in conversations on GB energy, pressuring Ofgem to abolish the standing charge, ensuring there is a huge amount of support for everyone to have enough energy free of charge to meet everyone's needs of heating, cooking, and lighting, which we've been demanding through our Energy for All campaign. Despite our efforts, we have seen no action on energy pricing so far, no positive action at least. Not to prevent bills rising, as they did on the 1st of October, nor to reverse the cruel decision to means test winter fuel payments, thereby making support inaccessible to millions of people most vulnerable to the cold while prices are rising. Here to tell us more about this evening is our first speaker, Jan Short, who is the General Secretary of the National Pensioners Convention, the NPC. Thank you for being with us this evening, Jan.
Okay, thank you very much. And before we start, I just want to thank everybody that has been part of the Winter Fuel campaign, because it has been a massive job to do. So, and I hope you'll stick with us because it's not over yet. So what does the NPC do? Well, our aims and objectives are really to ensure dignity and respect and financial security in retirement. Now, as you can imagine right now, that is a hard task. Yeah. But it's really, really pleasing to see how many MPs are now getting the message and coming on board. So when we actually got the shock announcement in July about the winter fuel allowance being taken away from all those on pension credit, you can imagine our members were absolutely furious. You know, it wasn't in the Labour Party manifesto, and to expect older people to be able to adjust their budgets at short notice, before the 1st of October increase is absolutely insane. The older people have a fixed income, and the majority of them will allocate their funds according to their bills. And there's not a lot of wiggle room. So to spring it on you and say, right, you're not going to get your winter fuel allowance this winter, pretty much appalled everybody. And there's no real explanation as to why they want to do it now. The Chancellor's reasoning behind it were, oh, if we don't do this, we could have a run on the pound and it could affect the economy. Well, the Bank of England and financial gurus showed us that was a fairy tale, because not only would it not cause a run on the pound, it would not affect the economy in the way that she said. So when winter comes along, older people have always got a difficult choice. Their fixed income, is, as I say, is allocated, and there's not just the energy bill to pay for, there's all the other bills. And the income that they get is less than half of someone that would be working full-time on a minimum wage. So they have to make really tough decisions. And that decision is, do I put the heating on? Do I heat something to eat that's hot? Do I pay another bill, or do I pay my carers? And this is the situation that is now being completely and utterly squeezed to the hilt. So they are tough decisions, tougher decisions than the Chancellor made, I have to say. So traditionally, older people are really proud, and that's why sometimes they fall into poverty and they don't let anybody know, they don't ask for help, they don't find places to go. And we find that those places to go are getting less and less. So they can't find them, so they don't go. And that is coupled with the fact that the application for the pension credit is 243 questions long. I mean, what? Why? So there's little help out there to support people, and often older people will see it as charity. And we try very hard to say that it's not, but older people have a kind of sense of being and have been brought up to look after themselves, really. So the impact on those just above pension credit is going to be enormous, even on people that are on a moderate income just above that pension credit. And AGUK has done some really good research and done their impact assessment and shows that those people just above will be falling into poverty, and others who are slightly better off will still be struggling and potentially can fall into poverty. So, it's for those that it's affecting really badly. It's around, do I have the heating on? Do I cook a meal? And those with health issues and disabilities have already started to either cut down on their care packages or cut them out altogether. And that is devastating for them, their families, for the health services. And, really, we have enough money for everybody. It's just in the wrong hands. We all know, sitting around the table, cold times occur. We've got a risk of stroke, heart disease, respiratory conditions, and it actually exacerbates any other health issues that you've got. So it will be that some people will freeze and some people will die. There is no other way of putting it. So we have challenged, and we will continue to challenge. The government tends to misrepresent older people. The ageism, the stereotyping, the concept that we're all doing very nicely, thank you. And the disrespect towards older people who are continuing to give, even though they're retired. The largest group of volunteers are in the over 65 age group. And we contribute £160 billion a year to the Treasury through direct taxes and VAT. And we also contribute over and above in kind because we care for grandchildren to save the cost of the extortionate childcare. And we also care for families, which means that the government saves around about £192 billion a year. And because we can use our bus passes to go out into the community, not only are we volunteering, but we're also contributing to the economy. And basically, if we look at how much volunteering we do, that's another £7.7 million. And charities will tell you in no way, no doubt, without older people volunteering, they could not exist. So, coupled with the loss of the winter fuel allowance, we've now got the increases in the energy costs, the freezing of the tax threshold. So pensioners are losing more and more of their income and their purchasing power. So, contrary to the messages you're getting from government that the triple lock will replace what we lose on the winter fuel allowance, it's a fairy tale, absolute fairy tale. Triple lock, even though we don't get it till April 2025, as is already devalued. We've got 10% now on energy and a potential 3% in January. That's 13% over and above a 4% increase in our triple lock. In April, as we get our triple lock payment, every bill imaginable that comes through your door will have an increase on it. Rent, council tax, water, you name it. Yeah. And pensioners have to actually factor in those bills as well. So we have the same bills as everybody else, with half the income to pay for it. Now, this promise that over the lifetime of the Parliament, pensioners will get £1,700 increase on their triple lock. Actually, absolutely nonsense, right? Office for Budget Responsibility has done a quick assessment, and it tells us that over the life of this Parliament, by the time Parliament ends, the triple lock will only be 1% above what it would normally be under normal circumstances. So nothing there for you. And I have to say, a majority of pensioners do not get the full state pension, whether they're on the new state pension or the basic state pension. So whatever percentage we get is only levelled at the level you're at. So very few people will be getting the full amount of the triple lock. So we continue to campaign, and our strategy at the moment is we're targeting every MP with Dispelling the Myths, and that is on our website if you want to go on there, www.mpcuk.org, and you can download it for free. And we're targeting every MP and every CLP through Unite the Union. Yeah. Because what we want them to understand is making this decision could cost them, the government. We've already got a Prime Minister that is minus 36% in his rating, and by-elections lost, and that has been purely on the winter fuel. We know that for a fact. So we were the workers of yesterday. Workers of today are the pensioners of the future. So we work together. We need to work together, intergenerational solidarity, because we want the workers of today to have a better retirement that we've got now when they get there. And we have every intention of we're having a drip effect every day or every other day in the press, alongside targeting MPs and their CLPs. And so what we're saying is there's time for a change. Need to find the moral compass and the principles that the Labour Party used to have in the olden days around looking after the many, not the few. Yeah. Sadly, not the Labour Party I grew up with, and probably you didn't either. But there is time. Right? She can put her hands up and say, I made a mistake. She can reinstate the winter fuel allowance before the budget day. Yeah. Whether she will, we don't know. But it doesn't matter, because come budget day, we'll still be there. And after budget day, we'll still be there. Right? Winter fuel allowance is a lifeline for a lot of people. Yes, we have rich pensioners, but they're not in the majority. The majority that we know are struggling, right? You've got 1.1 million pensioners who already have a pension pot of £1 million. Well, they don't need that. We don't think pensioners who pay the top level of tax need it either. But what you can do is look at how you can taper it. So someone that is on pension credit will get the full amount. Someone who's just above pension credit probably get 70, 80%. Someone else who's still in trouble but got a little bit more money, so you taper it off. So everybody gets a little bit of something. So that's where we are. And I'd just like to take a bit of time before I go, because basically we just found out this morning that there is a text scam. So if you know an older person with a mobile file getting a text, at the moment it's confined to Lancashire, but that's not to say that it won't move out across the country. And what the scam is, it purports to come from the government. Well, we know the government doesn't text you the message that you're likely to get. And what it says is, if you've lost your winter fuel allowance, you can apply for this living support. Yeah. And there's a link that will take you to a false website. And the website traditionally asks you for all your personal details, including your bank account. So our group of people in Lancashire have spread it right around our groups. It'll be on our website. If it's not already on, it'll be on there tomorrow. But if you know any other people, just to make sure that if something comes from the government saying, go to this website to apply for more money if you've lost your winter fuel allowance, it is absolutely a scam. Yeah. So thank you very much. And, I'm so pleased that we work together, and, the wealth of information around energy, we could never in a million years have got that far without you. So thank you very much.
Thank you so much for that, Jan. Really appreciate it. And yeah, we'll be taking questions and comments at the end of the session. So if you have some for Jan, please make sure you stick around for that. Next, we'll be hearing from Meg McDonald, who is a retired teacher who lives in disrepair and fuel poverty in a large basement flat in an old Victorian house. And no doubt Meg will be able to share some experiences that echo some of what Jan said. Meg, thank you for being here this evening.
Thanks for inviting me. I'm speaking in place of Diane, who is going to speak today, a personal view of what it's like to live in a flat in fuel poverty and disrepair. And so I hope that I can speak well about this. I just want to read a few things and then I'll say things that they. So I wanted to point out that under international law and the UN human rights, to be adequately housed means having secure tenure, not to worry about being evicted, and having your home or land taken away. It means having somewhere that is in keeping with your culture and having access to appropriate services, schools, and employment. The key to this human right is the implementation of this human right through appropriate government policy and programs, including national housing strategies. Now, can you remember Grenfell about this? So it goes on to say that adequate housing must have availability of services and so on, adequate sanitation, energy for cooking, heating, lighting, food storage, and refuse disposal. These are all under Article 25 of the Declaration of Human Rights 1948 and Article 11.1 of the 1966 International Covenant on Economic, Social and Cultural Rights. I keep saying this to people, but does this remind you of FPA's demands? Because it does me. Anyway, I've said this before. I'm sorry if people have heard me repeat this before, but Professor Sir Michael Marmot, and I think most of you know who he is, says that there are millions in a rich country like ours living in cold homes, which is a national disgrace. And the Institute of Health calls for the urgent need for warm homes for all, with a rollout of home insulation, starting with the people who need it most. Now, Fuel Poverty Action has been saying this for a long, long time. It's important in terms of climate change as well. And the Institute of Health reveals that if you live in a cold home, your risk of developing a new mental health condition is doubled. Cold homes put 1 in 4 children at risk of multiple health conditions. And as Jan said, cold homes increase the risk of heart attacks, respiratory conditions like asthma, bronchitis, pneumonia, emphysema, and even impacting children's brains and lung development and death. And nearly 5,000 people died last year because of cold homes. And the UK has the highest number of old homes, non-insulated homes in Europe, which are the least energy efficient. Anyway, to get on to sort of my flat. I've lived here since 1967 in North Kensington, and I can see Grenfell from my backyard. So, it's been quite a traumatic journey for us all. So I'm 82 and have lived in this private rented accommodation basement flat of an old Victorian house since 1967. I've never been able to buy a home because of my low salary. I was a teacher, and also because in the days when we tried to buy homes, there was a lot of discrimination against women. And it was easy in 1967 to rent a place in North Kensington because a lot of the homes around here well, not like they are now. I mean, now they are people want to live in North Kensington because and the homes here are so expensive. Anyway, the 1977 Rent Act, after Margaret Thatcher started messing around with all the Rent Acts, I'm fortunate to be under the 1977 Rent Act, which gives me a statutory tenancy. So my lease is continuous, providing I can pay my rent, which goes up by a formula. 4 statutory private tenants every 2 years, dependent on the rate of inflation. And this formula is a sort of a rent control, and it was brought in by the Labour government after a private renters campaign, which I was involved in, called Fairer Rents. And it was started by a school teacher because private rents were going up without any capping in the early days in the 70s and the 80s. So my flat is big with no central heating. It only had electric fires and to keep warm, and was impossible to keep warm. So I put in gas fires, and I think you can see one behind me now. Look, these are the ones I had to put in, and as you can see, they're still here. And this is, I cannot understand how these gas fires, they're so old, are being passed each year by the the statutory requirement of landlords to ensure that these work. Anyway, so, but if my if and these also cause a huge carbon footprint, which we've talked about before, and I'm quite aware of that, and I'm quite sad that I can't have any other form of central heating. But if my landlords did put in central heating, then my rent would go up by double, perhaps even treble, because it's counted as an improvement. And I've always been in touch with the rent. It used to be the rent officer now. It used to be the rent officer, but now it's called the evaluation office about this. I also have these huge sash-cored windows that you see in these Victorian houses. And the drafts that come through these sash-cored windows are huge, but they were put in Victorian houses to actually enable drafts to go because of the coal fires. So they needed air going through. So what I had to do was to put this stuff up. Look, this is called secondary glazing. Here we go. And it's like cling film on all the windows. And it's called secondary glazing film. And you have to put it up. It takes a while to put it up, but this in fact works. And it keeps the cold out and also noise. But the problem about this is if you've got it stuck on all your windows, you can't open your windows and you can't get any fresh air in. So I just have to readjust these. Anyway, so I've also got things like an old boiler the same boiler, electric boiler that I had in 1967 in my flat that is still working now. And my landlord refuses to put in a new one because they say, well, it is working and you're getting hot water. But the amount of electricity it uses is phenomenal, particularly since, as we've seen, the price of energy has gone up phenomenally. And also, I can only heat one room at a time. And that in itself is bad because you heat one room, but then you go out into a cold flat. And for the elderly and the disabled and the vulnerable, this is really bad for them because it actually, that drop in temperature can cause blood pressure to change. It can cause all sorts of things. It's not, it's not an option. And the other thing is that we should have an ambient temperature of about 18 degrees centigrade to 20 degrees centigrade throughout our flats when we're elderly, vulnerable, the very young that needs an ambient temperature throughout the flat. Anyway, so where am I on this one? The other thing is cooking. When you're older and you've got these huge rises in your energy bills, you don't want to cook so much. So what you do is you say cook. I cook like a big thing once a week and then shove it in bits and bobs in the freezer. But then you have to use a microwave or something. So you don't use a microwave or so on. Even so, not I also buy sometimes processed food, which is really bad for us. And it's not healthy to do that. So these are affecting us in big ways. The other thing is my bathroom. It is absolutely like a fridge. It's so cold. So in order to heat my bathroom, it will cost so much money using a stupid little electric fan heater on the wall, and it will cost a lot of money. So it's very difficult. So you shower infrequently, and this in itself is not good, for hygiene, because you're cutting down on giving yourself a shower or a bath. And if you're old anyway, you can't get in a bath. And only got a bath, which I have to climb over, and I've got bad knees. So all these things, the landlords will not do if you're a private renter, which I am. I'm a private renter. And but my landlord, you see, they say this is all above board. So what else have I got on that one? Yeah, the other thing is that we know now that the number of private rents in the private rented sector, we know that more homes are in disrepair than in the social rented sector. And we know that the number of private renters is at an all-time high, meaning that more and more people will need to cover the cost of their rent. We know that rents are going up huge amounts each year, whilst living on a fixed and meager incomes and pensions. And also my rent goes up by a formula, which is based on the rate of inflation. And if the rate of inflation is high, our rents go up enormously. And we then, and particularly for, as Jan said, particularly for pensioners, if you're you're really basically on a fixed income. And I'm on a state pension and on a teacher's pension, but these two pensions don't enable me to claim for pension credit because I'm just over that line, and I can't claim for that. And so there's well, I think there are millions of us are actually in that position. So we can't claim pension credit. We're in fuel poverty. Our rents are going up. Food prices are going up. And we also, our landlords, most of our landlords are not helpful, and particularly if we're old. And in an area like I live in, where my flat now would probably sell for £3 million, when my first landlord bought the whole house for £25,000. They want us out, basically. They're waiting until we snuff it. And anyway, so trends show that pensioner poverty is getting and will get worse in the future with rising rates of poverty and what is now classified as deep poverty. So pensioners are entering deep poverty with increasing housing costs and the cost of living crisis. Of the 3.5 million non-decent homes in England, those failing to meet the decent home standard, and mine doesn't, the private renter sector has the highest proportion of non-decent homes. So older renters are likely to live in the poorest in the poorest places. And women pensioners are the worst hit and experience more poverty than their male counterparts due to pension, a 40% gender pension gap, but that's due to their pay in earlier years and their work patterns, low incomes, raising families and time off work, having no vocational pensions, poor savings and so on. And Jan's already said some pensioners only live on a state pension and they don't get the full amount of that. And then that's when you have to claim pension credit. And we have the worst pensions in Europe and nearly at the bottom of the OECD countries. I've nearly finished. Anyway, so women, Black and ethnic groups are the poorest and the worst hit. And so fuel poverty is an equalities issue. And this government has not consulted or done an equalities assessment when cutting the universal fuel allowance. And I was just talking earlier, Unite are even thinking of taking legal action about this. They've got a series of strategies and that they're going to carry out. And even if you can claim pension credit We know that there's about 800 pensioners that are not claiming pension credit, because they're proud, maybe proud.
800,000.
800,000, yeah. And they can't fill in the pension credit form, which is 24 pages long. And even with my even I'm an English speaker. I live in North Kent, and I'm surrounded by. I used to teach at the local college, Easel, before I was a science lecturer. But to teach, when you live in an ethnic community, many pensioners of that group, their first language is not English. So to fill out a pension credit form is going to be so difficult for them. We believe that in Kensington alone, we've got about 3.5 pensioners who are not claiming pension credit. So we've got a big task ahead of us, and we're trying in North Kensington now to set up warm, safe spaces, invite pensioners in, get people to come and help them fill in their pension credit forms and so on. So this is what we're trying to do. But as Jan said, we've got to put pressure on this government because, like Jan, it doesn't represent a Labour government to me that I feel proud of. And we've got to keep up the pressure in all ways that we can. We've got to be out there and to try and but before the 30th of October, actually, because the 30th of October is budget day, and there are a lot of people that are going to be affected by that, pensioners, and also the WASPy women as well, that they want to know what's happening about um, the women against state pension inequality. They've been treated really badly. And they're having a demonstration outside Parliament on the 30th of October, which is budget day. So anyway, I'll finish there. There's a lot more I could say, but I think I've been rambling on for more than 7 minutes. Thanks.
Thank you so much for that, Meg. Yeah, thanks for speaking about your own experience, and yeah, also getting a lot more in there, stats, figures, and what people can do. If anyone else who's listening is thinking they would also like to speak up, you're very welcome to get in touch at Fuel Poverty Action at gmail.com, and yeah, we'll get you looped in with our brilliant comms lead who will take very good care of you, and yeah, keep that in mind. Next up, we have one of Fuel Poverty Action's directors, Ruth London, who's going to talk a little bit more about energy for all and the importance of putting needs above means.
Yeah, that was great, Meg. Thank you. I want to go back to the winter fuel payment because what's happened with that cut is actually a really interesting story, and we can learn a lot from it. Originally, the winter fuel payment was given to all pensioners in recognition, of course, of the fact that pensioners need heat more than most younger people. And the idea of going by what you actually need is a principle that actually my parents' generation fought for. We won a lot, and we did as well, my generation. We won a lot that was not means tested, but universal. We got the NHS for all. We got child benefit, which was originally family allowance for all children. We got council housing, which was originally planned as a cohesive mixed community where the doctor and teacher lived next door to the bin man, and you didn't have to be in poverty to live on a council estate. And now we're told that the country can't afford universal anything because the country is so poor that every benefit needs to be targeted at those who need it most. Everything needs to be means tested, and God forbid someone might get help who isn't actually hungry. Does it make you wonder where the money's gone? I'm sure Rachel Reeves thought that she would have the public with her. After all, many of today's pensioners were born into a golden age relative to younger people now. We got free university education, free prescriptions, free dentistry, and a lot more of my generation own their own homes, even if many can't afford to keep those homes warm. So I guess the government figured that the cut would go down fine, so long as they, quote, protected people on pension credit. And they went ahead and they cut off 2 million people, including 5 out of 6 pensioners in poverty. The Chancellor decided that it was better to risk 4,000 extra deaths a year than to risk people getting state money when they aren't poor enough. And because the idea of there being no money is so pervasive, so dominant, Rachel Reeves thought that people would agree with her. But look what happened. There's been this huge campaign that the NPC and Fuel Poverty Action and many others are part of. We've had a motion actually passed at Labour Party conference against the Labour government, demanding a reverse of the cut. There's been a huge outcry from pensioners' organisations, of course, but also from loads of younger people on radio call-ins and writing letters to their MPs. We've had loads of economists pointing out that the cut won't save the promised 1.4 billion. Probably it won't save much at all. And I don't think tapering would solve the problem, that a huge amount of the money that is saved would go into bureaucracy and just, administrating, making it non-universal. So it turns out that the public do not agree with Reeves's strategy. This time, with the winter fuel payment, divide and rule, that trusty tool, divide and rule, didn't work. Most of us don't know enough about economics to challenge the specifics of black holes and the rest. On the other hand, we've seen the money, and there's plenty of it. The trouble is that 57% of the wealth and counting is in the hands of just 10% of the population. High-class prostitutes who accompany their dates to the casinos once came back to their organizations and reported, "We have seen the money that they say doesn't exist." People have also seen the record profits of the energy corporations, huge multinationals growing fat on the money from our bills, and they cannot accept that people who've cut their energy use to practically zero are still paying a huge standing charge to these same rich corporations. So now you get Reeves seeming to get a little nervous and saying, well, after all, maybe there's another way to look at debt. Let's change the definition. I hope, like Jan, that she'll back down on the winter fuel payment. It's going to be difficult for her because in politics, saving face is more important than saving lives. But maybe she can find another way. It won't be quick enough to be in place this winter, but on the question of energy, Fuel Poverty Action is offering another way. I think everyone here will have heard of Energy for All, where everyone will get enough energy free to cover heating, lighting, washing, cooking, charging devices, and disability aids, enough to cover the essentials. That means that instead of looking at people's income, the government will have to properly audit our needs, including housing conditions, age, disabilities. If a government is serious about meeting people's needs, surely they have to find out what those needs actually are. Energy for All will be paid for in part by taking money from the fossil fuel industry, and in part by higher tariffs for people using energy that they don't need, people heating all the rooms in a mansion or a private swimming pool. Energy for All would make that extremely expensive, which would also help cut down carbon emissions. On the 1st of October, we gave in a petition for it with 662,000 signatures. Energy for All is universal, like the NHS. You won't have to be on death's door to receive it. You won't have to be on the internet to receive it. You won't have to speak good English or have an advocate from a helpful charity to make your case. You won't need to jump through hoops to get the basic energy you need for warmth and cooking and washing and living a little bit. Energy for All is a rejection of the means testing strategy for carving up our communities and keeping us poor. Now, I want to be upfront with you. There's been a debate about energy pricing. There are many organizations that we work with on fuel poverty. We've joined forces with them all on the winter fuel payment, but we have a difference with some of them over what is called a social tariff, because basically that means means testing, with a lower tariff for people at the bottom of the economic pile. These lobby organizations are alive to the problems with cliff edges, where people who are just above a certain limit actually end up much worse off or dead because they don't qualify for a benefit. They also know that many pensioners don't claim means-tested benefits, but some of them have been convinced by successive governments that they have to target benefits at the worst off part of the population because there isn't enough to go round for anyone else. I hope they will look again after what's happened this autumn. What's happened with the winter fuel payment has taught me a lot about means testing. I hope it's taught the government something too.
Thank you so much for that, Ruth. Really appreciate you being here this evening. And last but not least, on tonight, we are going to hear from Dr. Chris Hay, who is a consultant geriatrician, a doctor specializing in older adults, and is based in Glasgow and is interested in fuel poverty and the health consequences in older adults. Chris, thank you for being with us this evening.
Thanks very much for having me. Just a technical point, can everyone see the slides and me clicking through them?
Yes, they're in full screen now.
You can see that? Great, thank you. And thanks so much for having me. And I agree with the previous speakers and their passionate arguments. So I've been asked to present some of the dangers of living in cold homes from an NHS and healthcare point of view. And I'm Chris. I work with older adults and based in Glasgow. So I'm going to focus on older adults. That there obviously are lots of other vulnerable groups who are at risk and are experiencing fuel poverty. But in terms of numbers, the older adults certainly make up the largest group, and that is the area that I work in. So that's why I'm going to talk about that. Going to talk about some of the guidelines that we should absolutely be shouting about. The concept of vulnerability and some frailty, what this means to the NHS, and then a case that we come across in hospital. And I think what I personally wanted to do is to give everyone here confidence to speak about the health consequences in plain language, so that if you do strike up a conversation wherever you are, you can speak with confidence. So I think the key figure to get out is that there is a World Health Organization strong recommendation that indoor temperatures are kept between 18 to 21 degrees. And I think we really have to shout about that because it is very conveniently not spoken about enough. And that when that temperature drops below that threshold, there are serious health risks and consequences. And I think we should keep on shouting about that as much as possible, because it's conveniently, I do not really see it in any argument about indoor temperatures. So what are the risks, as some people have alluded to already? So there's an increased risk of heart attacks, there's an increased risk of stroke, increased risk of lung conditions getting worse, such as people who suffer with asthma and emphysema, and a deterioration in mental health, and this includes dementia. So you can see from the population that suffer from all of these, we're talking about a very large number of our older adult population. So why particularly are older adults at risk? When people age, you accumulate health conditions, and therefore you're more at risk to suffer from the bad consequences of being exposed to cold. You're more likely to be frail, and I'll talk about that in a little bit. And although this is not everybody, you are increased risk of being isolated, and being isolated is not good for your health. Older adults who are isolated may not have the same support system that older people have, such as family, maybe to tie them over or to prevent some of the health consequences. And as people have spoken about much more eloquently than me, the benefit system is incredibly complicated, often requires, I think, help. I've tried to pretend myself and gone through the system, and it's really complicated. I think of myself as IT savvy, but very complicated. And I think we know lots of myself, my colleagues' experience that older adults underclaim and don't claim. And I think this leaves people at particular risk. So just briefly, the context of frailty. So a lot of older adults are unfortunately frail, not everyone, but there are very high numbers of that. And what it means is that if you are frail, you are more likely to be have negative consequences. So you're vulnerable. to cold homes in this specific context. So that what frailty in this context means. So what is the cost to the NHS as a whole? It is very high. There is lots of varied estimates, and I'm not an economist, but it is very, very large. And there was a House of Parliament report, which I put in the slide there, that says we're looking at billions, millions of pounds here. And it obviously also, unfortunately, contributes to excess winter deaths. So we're talking about a very, very high cost nationally and also to the individual. So when older adults suffer from consequences of cold homes, commonly present to health and social care, the interesting thing is that presentation might not be immediately obvious it's directly linked to cold. There are older adults that do present with direct hypothermia, so that's the temperature being at a dangerous level, but probably the vast majority of them actually don't. And there's many factors in play that cold homes can start to be part of a negative spiral. So what do I mean by that? So I thought I'd illustrate with the case that is fictional, but it's very common in our hospitals and social care. So an 80-year-old older person comes to A&E with a fall. They've unfortunately broken their hip, and the nurses and doctors have thought, well, they've unfortunately lost balance, and then they've fallen and broken the hip. And what that means, that person will almost certainly have surgery, most likely have a long stay in hospital, and there's a significant chance they're not returning home or unfortunately dying from that consequence. So on the face that you wouldn't think that was perhaps related to fuel poverty. However, if you don't have an adequate source of heat, we know that your breathing will be worse. You're more likely to move less. You are burning up calories that you might not be able to afford to lose in order to keep warm, and therefore you're more likely to fall. So that's an example of a scenario that we commonly see that isn't directly linked to those consequences that we spoke earlier. So that's just an example that we see commonly of, unfortunately, a negative spiral when someone doesn't have adequate heat in their home. So that was a very quick whistle-stop tour. I will stop sharing, but I'll definitely invite questions and any discussion, anything I've just said. And yeah, thanks for having me.
Chris, thank you. That's brilliant. Great to have you on. If you wouldn't mind sharing that report you put in the slides, I will be glad to publish it, put it in the chat, and also send it out more widely through our newsletter.
Happy to.
We now gonna move into the second part of the session, where I hand over to everyone else joining us for reactions, reflections, questions, and comments. You can raise your virtual hand to come in, or simply, or you can also raise your hand on the camera, and I will try and spot you and bring you in. I'm just going to make sure that everyone can mute themselves. There we go. Thanks for that, Chris. And let me also, I can also invite our previous speakers to, give yes, Meg, thanks for coming in.
Yeah, I'd like to thank Chris for actually rounding all that off about the health impact of cold homes, because I tried to put some in what I was talking about. I also forgot to mention about particularly private renters are more likely to be in disrepair, and particularly if you live in if your rent goes up like every 2 years, and if the economic situation and you've got high rates of inflation, then your rent's going to be so high that you have less money if you're a pensioner, because you've got a fixed amount of money to pay on things like for food and fuel and so on. Now my rent's gone up to nearly 17,000 a year, which is 2/3 of my pensions, and that's a huge amount that I have to spend on rent. And even though I'm living in disrepair, and I'm not the only one, because I've actually, when Emma Dent Kirby became the first Labour MP of Kensington. I used to go around with her, knocking on doors and talking to people, and I've seen worse conditions that I live in, and I just don't know how people are going to actually survive. To be quite honest, it's I'm next year. I'm just I don't look forward to what's going to happen next year to the number of pensioners that are going to die because of all these health conditions and because of their cold homes. And I think it's really going to be serious. And as Chris said, the effect on the NHS, and Ruth saying in order to actually carry out I'm getting sorry, I'm getting mixed up now. To cold homes actually cost the NHS more, and if we have to go through a system of actually working out how much we're entitled to, what's it called again? Sorry, my mind's gone now. It's going to cost more to actually put that into process, yeah, thanks. I'll finish there.
Thanks for that, Meg. Jan, you wanted to come in?
Yeah, I'm kind of interested in what you're saying, Dr. Hay, because we know that we have a lot of our members, they've already switched their heating off and said they won't use it this winter. But more worryingly is we've got a number of members who switched it off last year and are not going to switch it on. So we are getting the cumulative effect of 2 years in the cold is going to be really, really disastrous for them, isn't it?
Please call me Chris, Jan. But yes, unfortunately, so the more time you're exposed to cold, the more likely it is you will have negative health effects that you can know about, but not just directly, but unfortunately that case of not turning your heating on can create a negative spiral in so many ways, and not just falling, but also with your heating, with your mouth care, with all the other things that you need. So yeah, it would extremely concerning at people turning their heating off and not putting it back on. No.
Yeah, I mean, the other question I have, Chris, is like the person, your fictional person who fell and ended up in hospital. If that was to happen to somebody who was suffering hypothermia because they're in a really cold home, they're freezing, would they then be discharged back to that home, or would they be judged to need, care in a care home?
Yeah, excellent question. So we've got very clear guidelines that you can't discharge someone back to their home if it is uninhabitable, and that includes the temperature. So you'd hope not, but I do suspect people fall for the cracks, and why do I suspect through? It's because people say, if they are isolated and they really want to go back to their home, they might not, although their heating works per se if you turned it on, but they might not admit to turning it off.
Yeah. Mm-hmm.
So the short answer to the question is it shouldn't happen, but I suspect a lot of people are falling through the cracks because of concern about partly of the stigma, but also the financial consequences. And of course, everyone wants to be home. Nobody wants to be in hospital. So yeah, short answer, yes, but I suspect lots of people fall through the cracks. Yeah.
Yeah, and like I said, we find a lot of our people are extremely proud.
Yeah.
And they won't admit that they're struggling, and they won't ask for help. So we're trying to find ways of, getting through to them that, yes, you might end up in debt, but you shouldn't end up dead. Yeah. And, try and get some help in terms of how to deal with the debt. And that, so it's really difficult because, as I say, the older generation, particularly the really older end of our age group, the 85s, 95s coming up 100, they're saying to me, we were born in poverty, so we'll just die in poverty. And I'm going, no. the 21st century, you know, we're the sixth richest country in the economic world. So why should it be? So, you know, we're trying very hard to kind of encourage people to put their heating on, but, you know, you don't live with them. So, you know, you can't do it for them and you can't make them. And you have to give them that independence to make their own decisions. But it is worrying. So thank you, Chris, for that.
No, not at all, Jan. Thanks for speaking so passionately. And that is mine and the vast majority of our colleagues' experience, is that older adults don't claim to all that they should. And so in clinics and hospitals, we have the Age UK wee booklet that is probably pound for pound the best at explaining what you're entitled to and claiming for it. And I have to sort of really thrust it into people's hands and handbags because they're like, oh, I'll be all right. I'm like, no, come on, please take it. I agree. And Meg made a point about the overall cost. I just don't think it would add up. Cutting winter fuel payment, I don't think it's going to save any money. When you think about the huge healthcare costs alone, and then also all the other costs to society, such as, of course, people taking time off work to look after their elderly relative, which obviously does happen, the costs rapidly would mount out to a huge amount. So I really would love to see any kind of economic plan that this winter fuel payment is supposed to be saving us all money. I just don't think it's there.
Thank you for that, Chris. Ruth, you wanted to come in?
Yeah, take Jennifer first because I've spoken already.
Sure. Yeah, Jennifer.
Oh, that's it. Yes, a couple of quick points. One is, as a member of Unite Community, I was with a group that went to Rachel Reeves' constituency last Tuesday, and we campaigned on the winter fuel allowance. We invited people to write a message to Rachel Reeves on a post-it note and stick it on a board. We have never had such a positive response to an action before. It was amazing. And the anger was palpable. They are absolutely, I mean, they don't like her anyway because she's a very poor constituency MP, but they were absolutely furious with this winter fuel allowance. So I don't know whether it's going to influence her. She seems to be the ice maiden, doesn't she? She's not influenced by anything. The second point I wanted to ask about was that there's been a suggestion that the local authorities will provide some sort of safety net, that they've got a fund that they can give to people. I just can't imagine that, you know, knowing the state of local authority finances, that actually exists. Does anybody know about that? And the third point I wanted to make was about economics. The government can never run out of money. Black hole, I'm sure you know that black holes, whatever size, budget deficits, whatever, are nothing to worry about. They don't, I mean, the black holes don't exist. The budget deficit is not something that we need to bother. The debt, whatever, somebody's debt is somebody else's asset. So, I mean, we really need to get the message of modern monetary theory out, or just heterodox economics, whatever. And I know that there are economists at national level who talk to each other about what they can do to get the message out. And a video has just been issued by Stephanie Kelton of the United States, which is very, very good on explaining why the government always has money, and it doesn't have to tax in order to spend. Taxation doesn't provide the money for spending at all. That's a ridiculous argument. Taxation actually cancels the money that is spent into the economy. So Rachel Reeves is just talking through her hat, really. She is an economic illiterate, and yet she has the power to cause such misery to people. And the media go along with her, and most people don't understand that what she's talking about is absolute nonsense. I can see some of you do know that. So that's all I wanted to say. Thank you.
Thank you for that.
And thank you for the contributions. Very interesting and useful.
Thanks, Jennifer. I think that's That's a great bit of economics for us there. Jan, did you want to come in and respond to some of
Yeah, thank you, Jennifer. I absolutely 100% agree with you. And that's what we're concentrating on with our drip press releases. In answer to your question, remember when we first hit the energy crisis and we were all given £400 off our energy bills, and pensioners received an uplift in their winter fuel allowance, but others got what they call a community support grant, which went through their local authority. Now, there's been some talk of having the same, but there's no detail, and I don't think we'll get that before the budget. So there's been talk of it, Jennifer, but we don't know what it is. Yeah. And it would be at the discretion of the local authority. Yeah. So the government will give the money to your local authority. The local authority will have a criteria for who they think should have that money, and they use that discretion. But there's nothing been written down. There's nothing concrete about that. So I'm guessing we'll have to wait till the budget unless Ruth knows something different. Yeah.
Thank you for
that's
that.
what it's all about, really. Yeah.
I don't know anything different from that. But I think, Jennifer, what you said was really helpful in looking at how things have changed, because it didn't used to be the assumption that basically people could be destitute. And then if you get it lucky and your local authority happened to be able to help you, or you happen to have a fuel bank that you hadn't used up your welcome at, or you happen to be lucky in some way, you might be a bit less destitute for a little while. You know, that's kind of an assumption now. And the monetarist theory, Margaret Thatcher's handbag, that is just like your household budget, and you have so much money in it, and that's all there is in it, and when you've used that up and spent it, well, there isn't anything else. Terribly sorry. That idea of how the economy works, it hasn't always been predominant. Keynesianism was predominant for a long time, and people knew that the economy worked by money going round in circles, and people working, and value moving to where it was needed. That theory is not, it's so dominant now that people forget that it wasn't always like this. And people also forget that it wasn't always normal for people in Britain to turn up in hospital with malnutrition. And it wasn't always normal for people to be turning their heat off altogether in the winter. And that is so common now that it's kind of become normal. And one of the things that is tragic about that is that even if you do turn your heat off, people are still paying the standing charge. And that is something that we've been fighting against. The standing charge means that even if you don't use any, you have to pay. Energy for all is the opposite of that. Even if you don't pay, you can use the energy you need. That's what you call a revolution, turning something over, standing it on its head. And that's the principle that we're going for.
Brilliant. Thanks for that, Ruth. Lee, you wanted to come in?
Yeah, just thank all the presenters, especially Meg. It's a very moving presentation, and thank you for talking about your situation. Just on the money not being there, as people have said, it's ludicrous that since the 1990s we've had a vast explosion in the wealth of the upper 0.1%. More billionaires in this country now. It's like 1,000% increase of their wealth, and the kind of there's hundreds of billionaires in the midst of this kind of energy crisis. And so the idea that there's no money is ludicrous and just wrong. And going back to modern monetary theory, I agree broadly with the idea that governments can never run out of money, especially countries that have a broad tax base and their own currency that's quite secure. the crinkle in that is the money needs to be spent for productive things, not just like tax cuts for the rich, which was the thing with Liz Truss. And so, yeah, and part of it would be productive to reduce kind of energy poverty. And so it needs to be done. And going back to the idea that tax is not relevant, I disagree with that, but respectfully, in that morally we should be taxing the richest people. And if we go back to what Ruth said about when we had universal kind of healthcare, when we had universal council housing, that was all done with very high taxes for the highest earners. Since the 1960s, 1970s, since neoliberalism came in, the top tax band has gone down while the lower tax band has gone up into this kind of tight mesh. I've got graphs on this if you want to see them there. But yeah, tax is relevant. We need to tax the richest. We need to tax billionaires out of existence, in my opinion, because they're an affront to both mass poverty and they're an affront. We ain't solving the climate crisis where you got people swanning around on private jets and on yachts, super yachts. Anyway, thank you.
Thank you.
Thank you for that. Lee, yeah, Meg, you wanted to come in? Was that a response to Lee, or just another point you have to make? Either way.
It's just, it reminds me, because I was born in the Second World War, and after the war we had the hugest debt, even more than they're saying they've got today, and yet the Labour government then introduced the welfare state and the NHS and every public services and so on, and reminding myself of the war. Like we're living today, people are living today, pensioners are living today, particularly older ones probably can remember that, because in the war these same things applied. We didn't have a bath. Bath very often because it cost a lot of money to heat the water. We couldn't go in our our homes are so cold, that we had ice on the windows and things like that. So all the doors we had with curtains up. We had several layers of curtains if we could find the material, which I've got now. I feel as though I'm back to childhood, living in war conditions and post-war conditions. And in fact, I went to see a friend of mine the other day, and we were talking about it because we're both the same age, and we both felt we were back again all those years ago. I mean, that is what's going on. It is that bad.
Thank you, Meg. Dilys, would you like to come in?
Hi, yeah.
Can I just answer Lee in terms of the rich? Yeah. We work with an organisation called Tax Justice UK. Yeah. And they are arguing furiously about taxing the rich and giving quite a lot of ways forward that the government can do it. But there's also this thing around the United Nations trying to get a global agreement on stopping huge corporations putting their money abroad out of reach. Now, they've just released a report by one of their partners, and it shows that the top 3 countries where most of the money is salted away are British colonies. So British Virgin Islands, Cayman Islands, and Bermuda. Yeah, they are the highest areas where money gets salted away. And it also shows that the UK is around 33% of that money that goes missing. Yeah. And since 2022, the previous government has refused to take part in the global taxation project. Yeah. I have written to Rachel Reeves and said, I hope this government will be more proactive in making sure that the right amount of tax money comes in to the UK to be spent on investment in people and growth. in the economy. Yeah. So that they're always a good set of people to have a look at. So Tax Justice UK. Plus, what we know in terms of the wealth now, most of it gained during COVID, I have to say. You've got 1% of the population, which is 685,850 individuals. And they've got more wealth than 70% of the rest of the population, which is 48 million people. Yeah. And the richest 50 families have a wealth of £50 billion. You take 1% off that, they're not going to miss it, are they? But it contributes a huge amount for other people. So we always say, ask the question again, why are you stealing from pensioners? Why are you not asking these people who have often made their wealth off the backs of hardworking people? Yeah. Why are you not asking them to contribute and, you know, be part of, you know, the country's economy? And we've got patriotic millionaires who are begging the government to tax them more. Yeah. They want to be taxed, they want to contribute. But it shouldn't just be on a handful of people, you know. And as I say, most of the wealth has come during COVID and all the corrupt contracts that were given out. And the rest of it is people who work for these corporations, sometimes on not very good wages, contribute to their wealth. So Tax Justice is a good organisation. It doesn't get funded. It relies on donations. So I give a donation every now and again. I can't do it every week or every month, but every now and again I'll give them 25 quid because they really do work hard for us. Yeah.
Yeah, I'm sicker.
Thank you for that, Jan. I just have a feeling that Lee, you want to maybe come back in and answer to that. Dilys, I'll hand over to you after.
Right.
Yeah, thanks. Just on that point, that if you're worried that people getting the winter fuel payment have more money and don't need it, how about taxing the richer people and then you get it back anyway? It makes sense. It's a foolish argument to say, oh, people are getting benefiting from a universal service when you're not even taxing rich people. That's the way to equalize that out, is to take the money back via tax. Agree completely. Tax Justice Network is a great organization. I read their stuff. They do some great reports about how banks, kind of all the big corporations are like just avoiding 20% of state tax. It's been made legal by the Conservative government, and I don't expect this government to do anything about it. So yes, it's a good organization. Yeah, so completely agree. Thank you.
Thanks, Lee. Dilys, sorry to keep you waiting.
I forgot what I was going to say now. Yeah, that I don't really understand how it would apply, right? The Energy for All campaign obviously is arguing for everybody to have a basic allowance of energy that would be enough for their needs, but I don't know how you would determine that. It seems to me that we have the lowest pensions in Europe, we have appallingly low social security benefits, we have job insecurity, we have low wages, and we shouldn't need, you know, to have special pots that pay out for people to have energy. We should have pensions that people can live on adequately without having to have winter fuel allowances. This is, you know, we shouldn't need extra winter fuel allowances or any other top-ups. It should be that benefits, including pensions, should be adequate to live on. I run a food bank, and the number of people who say, well, I've got a cooker, but I can't afford the gas to put it on, so can you just give me food that I don't have to cook? You know, and so this is not old people, this is families, many single people, particularly people with disabilities, mental health conditions, whatever, and their conditions are obviously being aggravated because social security is so bloody mean. However the money is acquired by taxation of the rich, which I fully agree with, but it just seems to me that we shouldn't need have a special pot of money that's allocated for people to a fuel allowance, because that's only one of many expenses that people simply can't afford.
Interesting point, Ellis. Ruth, would you like to come in on that?
Yeah, of course, we should have enough so that we don't, so that we can pay for everything that we need. But there's nothing intrinsically better about getting everything through wages or pensions than about getting it directly. And there's a lot to be said for an NHS that just gives, everybody can have the health they need without necessarily having enough money to be able to afford it. It doesn't have to go through money. Not everything has to go through money. It can be, that the energy is available, and it's going to be more and more available now because a lot of it can be produced for practically nothing with renewables. That doesn't mean that somebody has to work out the charge for it, and somebody then has to get enough money to pay for it and pay for it. It can be produced and sent into our homes, or it can be produced in our homes, as happens with solar panels. It doesn't have to go through the market economy to be valuable. And energy for all is a way of taking some of this out of the market economy and saying, okay, let's start with human need and start with what is going to satisfy that human need and make sure that that's in place. It's not, it's not a counter to saying that the pensions should rise so that people can afford what they need. It's compatible with that. But like the NHS or free university education, it is its own thing, provided.
Thank you for that, Ruth. Does that clarify some of your questions?
I'm not sure. So I didn't understand that this meant that everybody would get all energy free. Is that what you're saying?
No, not all, but what they need.
Yeah, but that's what I'm saying. You're putting it into a special pot. You're saying energy is one thing. How do you know how much energy I need? How do I know how much energy you need? How do you allocate that? It's still, you know what I mean? I live in a drafty home and I can't insulate it, because if I insulated it would get damp. It's an old home. So, and I've got a damp cellar. Next door to me doesn't have a damp cellar. So they don't need as much energy as I do. How do you allocate this? Not disagreeing really in principle, I just don't understand it.
Yeah, no, that's fair enough, Gillis, and that's something we've thought about a lot, obviously. Is not only the housing conditions that determine how much you need, it's also your health, your age, your family size, a whole load of factors. But the fact is that we're saying that there should be audits to actually find out what people's needs are. And the fact is that a lot of that's being done already anyway. You have the evaluations that are going around to say how much, how what the energy efficiency of homes are. That's being done. Evaluations of people's, family size and age and disabilities is basically done already through the benefit system and through the tax system. That these are already in place, and when there's somebody who contacts what they call energy doctors, or in different places they have different names for them, somebody who is getting help to ensure that they get the energy they need, they get assessed by somebody who comes around and looks at the damp, the condition of the house, who's living in the house, and makes an assessment. So that kind of stuff is actually happening. And our view is that if the government is serious about making sure that people get what they need, they can't skip the stage of finding out what those needs are. It's not perfect. It won't be perfect, but it will be ever so much better than what we have now. I don't know if Chris wants to come in on this.
Yeah, Chris.
Thanks. I, just from a health perspective, there have been some studies and some reports published by even the UK government about how to identify. Oh, everyone's frozen. I know, back. How to identify people at risk from a health perspective, and what. Then there are various screening tools, but we've actually from nationally got a fairly decent idea about identifying people with health conditions who would need an 18 to 21 degree threshold kept in their home. And so the obvious way for me for doing that would be those people, their homes should be heated to 21 degrees, and it should be measured. And if it isn't, it should be heated adequately. That I think is the most practical and kindest and most obvious way of doing it, rather than the other way around of, as Dilys said, just pumping in a set amount of energy they think they need, but it's actually the end product that we want. It's indoor temperature kept at a certain level, and that the government have published fairly decent reports about identifying the people whose health is at risk. It's the actioning doing that they seem to be looked down upon. I'm happy to post the reports. They're a few years old now. They're pre-COVID, but I think the heating on prescription, yeah, absolutely. And there's been a few studies on that, and I'm happy to post that in the chat as well with good results.
Thank you for that, Chris. I'm also posting in the chat some work, a report that was released by the New Economics Foundation that came out of some work we did with them, in which, concerning energy for all, and through which they sort of found some pricing fixes that are tailored to people's individual needs. As Ruth said, it's not perfect, and it's economic modeling, but it will give an idea of it does give an idea that it can be done. Just for your reading, Dilys. We are coming up to 5 minutes to 8. So I'm going to invite any final questions. If someone hasn't spoken and would like to speak up, please do it now. Yes, Jackie.
Hi everyone, and thank you so much for such an interesting evening and contributions. I'm very grateful for that. My point is probably from a little while ago, but these fiscal rules that Rachel Reeves is working to were made up by George Osborne. She can make her own up if she wanted to, and I'm incredulous that she's sticking with those rules. And also, I don't wish to be impolite, but she doesn't seem that bright. I know she worked at the Bank of England, but what planet is she living on? Not just about, the winter fuel allowances, but pretty much everything she suggests sounds disastrous for the country. So I'm a little bit horrified by what I'm seeing so far. They're a new government. They could make their own rules and defend them, but they're clearly not about to do that. And the only other thing, which is not strictly about fuel, but what really concerns me is the powers they're giving themselves to instruct banks to look at people's bank accounts who are on particular benefits, not pension, but probably on pension credit, and probably if you're on housing benefit. I get a little bit of housing benefit to help me along, which means in theory they can look at my bank. I've got nothing, but I absolutely resent people ferreting around in my bank account to see how poor I am and what I spend my money on. I mean, I'm pretty outraged by that. So I don't know whether anybody, I know it's not strictly to do with fuel, but it's linked to benefits, and some of these benefits, people will be having, whether they're young or old. So I just wondered if anybody got any views about that.
Let's start with Lee quickly, and then John.
Yeah, interestingly, Tax Watch, not Tax Justice Network, did a comparison between how the government treats rich tax evaders and how much resources it puts into it, and how it kind of the punitive benefit system. And I will bet my last bit of whatever money I've got that they're not going to start rooting around in rich people's bank accounts and see whether they're avoiding tax. They're just looking at, I mean, the only thing you get from this government is what you force out of them. They react. They don't plan forward, and they're not interested in justice or kind of equality. So the only thing we're going to get out of them is force.
John?
Yeah, I mean, Jackie, it's a matter of choice, isn't it? You know, governments have choice, and they choose to do what they choose to do now. They choose to take away winter fuel allowance. They'll choose to do whatever they want to do in the budget, whether they feel it's right or wrong. And I think you're absolutely right. Rachel Reeves comes across as a little bit of a snob, but not very bright. Yeah. And I think, you know, we can capitalise on that a bit, I think. Yeah, she's not very bright. I can see Meg killing herself laughing there, but, you know, we can, can't we? Because if she's not very bright, we can show her up for not being very bright. And we're trying to do that with the press releases that we're doing. But in terms of what Lee said, you know, they don't go into rich people's bank accounts because they know they're not paying tax because they're in the 3 richest colonies that we own, you know, Virgin Islands, Bermuda, and wherever, with Guernsey somewhere around about 7 or 8. So they don't need to go into rich people's bank accounts because they know they don't pay tax. What they can do, though, I mean, we've argued and we put a case forward that if they wanted to go into people's bank accounts, then what they needed to do was follow the GDPR rule and ask permission. Yeah. We were then told that GDPR doesn't cover banks, right? And therefore they didn't need to ask permission. So we then wrote back and said, well, can we get the banks to look into your bank account and tell us what you've got? Yeah. And surprisingly enough, we didn't get a reply to that. Yeah. So, you know, it's a rule for them and a rule for the rest of us. It's always been that way. It's not going to change much now, but we just continue to fight and fight until, you know, we can fight no more. Yeah, it's a choice that they're making. I mean, with Starmer minus 36% in his rating, if I were him, I'd be sitting in my bedroom thinking, Jesus, what do I need to do? You know, but he's not. He's out there swanning around in his best suits and getting Taylor Swift tickets. And
I was going to say he's at Taylor Swift
like that. And I think, you know, what kind of moral compass and ethical practices that showing to the younger people of this country to aspire to? You know, that's what worries me. It becomes the norm, as Ruth said, it's normal to switch your heating off now. So it becomes the norm, you know. It worries me about young people.
Yeah.
Thank you.
Thank
you for that, Jan. Thank you for that, Jackie. Margaret, I want to let you come in, but just so you're aware, we are ending the session. You've come right at the end. But yeah, please, say what you have to say.
Find the unmute button first. I've only just got down to the email in my stack to say that this is starting at 6:30. So I dive straight in to say my little piece, because I think that like everybody else who I have heard, or who I can see what they're thinking, because it stands out, that the wealthy few think that they own everybody and call all the shots. Well, to a certain extent they do, because the whole system is built around money, and they have managed to accrue far more of it than is their fair share, because they have not given fair shares to everybody else. But if climate crisis carries on the way it's going, civilization and money are not the future, because we cannot survive on the world that they will leave us. So, yeah, I mean, my very simplistic suggestion is let's put all the billionaires in jail, take all of their money, fix climate, and make sure everybody gets a basic income which is sufficient for their needs. Okay, I'll wind my neck in now and beetle off, but it ain't fair, and I was brought up to believe one should play fair. They don't.
Thank you very much for that, Margaret. Really,
it's a pleasure.
I think these are great thoughts to end the session on. And yeah, sad that you've missed it, but we'll post this on YouTube very soon, and you'll be able to watch it back. Keep an eye out on your emails for when that happens. Before I close, I'm just gonna post a final couple of links in the chat. Invite you to sign the Energy for All manifesto if you haven't already, either on an as an individual on base or as a member of the organization that you're part of, or for your trade, or get your trades council to sign as well. And please let us know how you found the session through a little Google form there. We really would like to hear your feedback. But thank you to everyone for joining, listening, and participating. And thanks again to our speakers for being with us tonight and making this such an informative session. I'd really appreciate if everyone could switch on their cameras, switch on their microphones, and just say good night.
Thank you.
Good
everyone.
Night, all.
Thank
Nice
you.
to see you all.
Thank
Bye.
you.
Yes.
Bye.
Right.
Thank you. Goodbye.
Bye.